Hey, this is Corey Barnes.
And this is Lisa Caperton, and you're listening to Her Turn to Talk.
How's it been going? I see you have pretty flowers in your background.
Yes, these are beautiful Gerba daisies that Travis got for me.
Oh, that's so sweet.
I've been trying ever since the pandemic started, and since we're on the computer all the time, not all the time, but often and doing Zoom, I figured I'm just spending a lot of time in my office, so I would get flowers. And so I've been just replenishing my flowers and getting new flowers. I think this is my third round, and I can see them in my camera as well. So I'm getting to enjoy them while I am talking with people on video calls.
Yeah, that's fun. I feel like I am in the countdown like I have never been for school to end. Because I haven't been able to like get on and do as much stuff. Like I've been kind of missing some get-togethers and things during the day because I have been all hands on deck with school. I was like, oh, okay, it's just a couple weeks left. Probably it's not. No, there is more crap than ever. I swear I am being challenged in math, in 6th grade math. Like my son had this whole packet to do, and I was trying to help him do these word problems. And Corey, I sat there forever, and I was like, I do not fucking know what. And so I had to look it up. So I'm like having to go and look up YouTube and watch videos on how to learn how to do it. And then we're coming back and we're like trying to like show each other, because they do things also different. It's not how we used to learn math. Like there's also a whole different way they're learning how to do it. And so it's like, fuck, I don't know. Like I know how to do it how I was taught, but I don't know how to do it like how they're teaching.
I wouldn't even know the first. I don't know how they're teaching it. I don't
You have to watch. It's all this Common Core is what they call it. But yeah, so it's just been a lot of work of, me watching videos and then us watching together and then trying to figure it out and trying to keep them focused. And I'm just like, oh my God, I need it to be done.
I'm so sorry.
It's all right. And then it comes a whole new problem of like, what the hell are we going to do all summer long? Like, I don't know.
Right? I saw that there was I was looking at paint and sip party. I was just thinking, something fun for us girls to do, and they're doing a virtual camp online.
Oh yeah. I know some are.
And I'm like, virtual camps for kids? I mean, I like the idea, but then again, I don't know.
It's just a lot of sitting in front of a computer, and it's like, I don't know. My kid has been doing a lot of house party calls. Have you seen this app? It's like an app.
I just heard about it.
FaceTime or something, but it's almost kind of like the Jackbox because it has a few games on it too. And that like last night was my son's birthday, and they had a house party call, and we were downstairs and we could just hear him up here laughing and made me really happy because it's like, they're having fun, good. So there are some small things.
Yeah, I overheard some people trying to predict whether or not there was going to be school in the fall because of
they actually already sent us out an email saying that they've made plans for different phases depending on like what is happening, of like from full-on online learning to like a staggered schedule to like a half and half at school, half at home. And they have all these different things, but they have no way to predict because that's 3 months away, 2.5 months away. Like, who the hell knows, But I guess they have to have a plan in place, because I know some parents are already like asking, and it's like, we haven't even got through this year yet.
Yeah.
I don't know. I'm excited to talk to our guest today about pelvic floor stuff. I was thinking recently.
Yes, Dr. Krystyna Holland. I'm very excited to chat with her.
Yeah. I was thinking back before all this started, and I told you about like my PT experience and how I was going and how like I got all weirded out because the lady kept telling me, oh, you're so cute. And I was like, I don't know.
That's right.
It was just a very weird place to be in when you're being held by someone, basically like in a baby position. Like I was being held in a position like I was a baby, and she's telling me, "Oh, you're so cute." But I don't think I told you that before that appointment, the first appointment was a different person, and she actually did talk to me a little bit about pelvic floor stuff. We had a whole conversation about how to poop and how to poop without straining, and like breathing techniques, and about the squatty potty. Have you seen those, haven't you?
I got me a squatty potty.
Yeah, I need to get one.
I love that thing. I think it works.
Well, that's what she was saying. Like, yeah, like the position and thinking about like different, how you're breathing. And it's so weird how that stuff all works, because she actually gave me some breathing exercises to like strengthen, I don't even know what that muscle is, but whatever that like cradling muscle is down in your pelvis.
Like the actual pelvic floor?
Yeah, I guess. Or there's like the transverse muscle that kind of goes across your hips.
Yep.
And so it's like you sit on all fours, and you breathe out while sucking that in. And it was so hard for me to get. And I've been lazy. I haven't been doing it as much as I should. But that was one of the problems with my hip, is because my pelvis was very unstable. And so like this is trying to help tighten the pelvis up, I guess. But it was just very interesting talking to her. She talked to me about all kinds about pooping and how to pee and changing your positions, and how sometimes if you can't empty your bladder, you might stand up and take a few steps and then sit back down, because that like repositions the bladder and like because have you ever had that happen where you like pee and then it's feels like you're still got to pee but nothing's happening?
Sure. Yep. Yes. So
many things. I feel like that. I don't know.
I'm interested about having pain during physical intimacy. Every once in a while, I'll get a little pain, and I've been told that there's other things. But I always find that if I'm in a good exercise routine, I never feel that pain. And when I'm out of my exercise routine, so I'm imagining my muscles are nice and strong when I'm exercising, and like they're strong. There's something that's going on there. And then when maybe a little muscle atrophy or something like that. So I'm curious to learn a little more about that, because I've experienced that when I'm not doing my regular exercise regimen. Because it sounds like all of this, it has to do with your core and just be doing exercise in general.
Yeah, I feel like it's a lot of mindful work, or at least for me, the exercises I've been told anyways, they really take a lot of brain power to do. And a lot of dedication, I feel like.
Yes. And I didn't even know anything like this actually existed until we found Dr. Holland.
Is she on here? Hi, Dr.
Yes.
Holland.
Hi. Yeah, hi. I was like creepily eavesdropping as I was getting all my stuff set up.
That's all right. You can creep on us.
Hi.
We're just talking about the pelvic floor and how we are interested to talk to you on some different questions that we had for you.
I love that. Yeah. Can you all hear me okay?
Yeah. You sound great.
I'm sad that you didn't know about pelvic floor before, and I'm super excited that you know about it now.
Well, that was Corey, and I actually know about pelvic floor only because I had to have the surgery after having my second child. So at like very young, at like age 30, I had to have a hysterectomy and like the whole thing, rectum, bladder, sling, all of that, all done. And so that for me, like, but I actually didn't get any physical therapy afterwards. Like they told me a few exercises to do, but they never sent me anywhere, nothing. And so I wonder how much problems that has caused.
When did you have the surgery?
Oh my gosh, that was like 10 years ago.
Yeah. Are you symptom free now? Do you have heaviness or leaking or anything like that?
Yeah, actually,
Sorry, I was to ask you super personal
No,
questions.
well, that's all right. Let's get personal for everybody to hear. But no, I do. I was just telling Corey, I actually went to a physical therapist kind of before all this COVID stuff happened. And because I was having hip issues and my SI joint. And so I also have joint instability. I have, I've been told that it's probable that I have EDS, but yes. And so anyways, I went to the PT doctor for my hip, and she has been telling me about different exercises for straining to like go to the bathroom and feel, because I told him like I still feel like I have to pee all the time, and I don't feel like I empty all the time. When I do pee, it's a whole process. There's a lot of moving around and readjusting, and sometimes there is heaviness still. And so, and I constantly get paranoid of going in and thinking like, oh, are things falling again? Are things falling again? And so far that hasn't happened, but sometimes I feel like it is.
Yeah. And so did you see a pelvic floor physical therapist?
No, so she wasn't. Like I said, I went there for my hip, and the person that I had my first consultation with was not the regular person I was going to be seeing. And she just happened to say that that's what she does, I guess, regularly, but she was just kind of filling in for the day. And so she kind of talked to me about that the first day, and then I was going back for my hip. So we never, I didn't see that person again. So I have not ever been to a pelvic floor specialist before.
Yeah. I think with all the things you just said, it could be really great and could give you some confidence and some clarity around what might be good for you, what might not be so good for you, and kind of decide from there. But just getting a lot of information, because I think we don't even talk about that part of our body, let alone like know anything about it.
No. Well, and that's just what I was telling Corey. I'm like, yeah, she was just gave me a few tips, like about pooping better and like how to position yourself and breathing techniques, and even for peeing, and like, how to, be able to pee a little bit better. And maybe, if you stand up for a minute and reposition and then sit down, and all of these different things, which was super interesting. But yeah, I
love that. She sounds great. Go see her.
So can you tell us, this is something that, what is the pelvic floor for people who don't know? Like, what does that entail? And I love that, I read something about that it's not just, it's not just a woman's issue. Like this is something that men have too. So can you tell us about that?
Yeah. Okay. I know that this is going to be a podcast and not a video, but I'm going to go get my model because it'll be way more clarifying. Okay. I will be right back.
Ooh, I love anatomical models.
I know. And she's got it right there at home.
I have so many questions. She has a really awesome Instagram.
She does. And well, you have the perfect question too, because she does a lot about sex wellness too. Mm-hmm. For our listeners, Krystyna is getting set up. She's got a model for us. We have a pelvic floor coming
Good old
out.
Pelvis.
Yeah, it's very enlightening, because I think it's really hard to conceptualize sometimes. So this, just for context, sits here, right? Mm-hmm. So 2 bony hip bones, pubic symphysis or pubic bone, spine, tailbone. So from the pubic bone to your tailbone, you have the sling of muscles. And they are really important because they play a role in sexual function. They play a role in bladder and bowel. They play a role in strength and stability. They even play a lymphatic function. And we literally never talk about them. So that's what they do. So that's what they are. This model would be someone who has a vulva. So that's urethra where urine comes out, vagina where a baby or your period would come out, and then a rectum where you would poop out of. But people who have penises also have pelvic floors. They just don't have the vaginal opening, but the urethra is pretty similar.
What is the medical term for a pelvic floor?
Pelvic floor. Yeah.
Oh, it's just pelvic. It's not anything fancy.
So there are a whole bunch. So they're individual muscles that make up the pelvic floor. So that's it. The pelvic floor kind of refers to the whole group of muscles. And there's this like superficial layer, the layer closest to the skin. And then there's a deeper layer as well.
So and we can exercise all those muscles simultaneously or one by one, or can I do it right now when I'm doing like a Kegel or whatever?
That's exactly what you're doing. Yeah. So when you Kegel, you're tensing the muscles of the pelvic floor. The tricky thing is that pelvic floor muscles should contract like in a Kegel, but they should also be able to relax. And so a lot of people will Kegel and Kegel and Kegel and like tighten and tense and grip here the same way that people will like hold stress in their upper traps or hold stress in their abdominal muscles or hold stress in their glutes or in their back muscles. And any of those things can be uncomfortable. And the same thing happens here. So if you imagine that these muscles are like the upper trap muscles, and so they get tight, they're like this, and then someone comes behind you and tries to give you a massage, and you're like, oh, please don't do that. Same thing can happen here. It can be a toy, it can be a penis, it can be anything. And so that can also be painful. So I see a lot of people who have sexual dysfunction, painful intercourse, trouble orgasming, and it can all come from the muscles. It can also come from a lot of other things, but I check the muscles and try and figure out what pieces go where.
Very interesting.
Yeah, so I talk about pee, poop, and sex all day.
So stress could actually be causing sexual pain.
It can, yeah. So stress can come from a lot of different places in a lot of different ways. So for example, we know from the literature that when people see videos that show danger, like stressful situations or dangerous situations that have a sexual undertone, these muscles activate in a stronger way than they do when they're seeing a happy movie clip. And even different than if you see a scary movie clip that doesn't have sexual undertones, these muscles will still tense from that, but it will happen to a lesser extent than, again, if it has sexual undertones, which makes sense because when these muscles are tense, it makes the vaginal canal functionally smaller, which makes a lot of sense evolutionarily, why we would want to do that.
Wow. Yeah. I didn't realize this idea of us holding tension and stress in our bodies. I know all about that. It hangs out just like as you described in my neck, in my trapezius, right? Mm-hmm. And how interesting, because I was saying to Lisa, I find when I exercise, I'm a big yoga enthusiast, and they talk about the pelvic floor in there, and we do bridge pose and, breathing techniques and stuff like that. And when I'm in the groove with that, I tend to always have really great sexual experiences. And then when I'm not exercising, like I'll go a couple of weeks where I'll stop and maybe some stress comes up, stuff like that. And it'll hurt. And I'll be like, oh, this isn't work, And
I think that some of it's probably blood flow too, right? Especially with yoga where you're getting in some of these interesting positions and they're cueing the breathing, you get more blood flow here, which makes it easier to be physiologically aroused, which might not be happening if you're not exercising.
And so, pelvic floor fitness or health, right? Mm-hmm. Does that also correlate to orgasms and having a really good orgasm or not?
Yeah, it definitely can. So people who don't have good control so on one hand, if you're having regular orgasms, that is pelvic floor strengthening because an orgasm is a big contraction and then a big relaxation.
Yeah.
So that's another reason that we should be having as many orgasms as we can tolerate. And then also that being able to contract those muscles voluntarily and having good awareness there can help you have easier orgasms because you know what needs to happen to get you where you're trying to go.
Wow. And when it comes to men, what kind of exercises or what if a man was to come to you about pelvic floor, what would be going on with them typically?
Yeah, so I have seen people who have testicular pain on one side. I've seen people who have low back pain that just doesn't really resolve with other types of treatment. So they've seen physios, they've seen chiropractors, and they're like, I still have this low back pain, or sometimes lower abdominal pain, or hip pain. So any of those things, or sometimes even issues with erectile dysfunction. Oh. That could be also a lot of things, but one of the things it can be is muscle related.
Huh. And for gender fluent people who have gotten surgeries to, have, reconstructive surgery, and now they've gone from penis to vagina or vagina to penis. Are you seeing clients like that as well? That must be something else. So you get to be a part of their whole transformation, and it's amazing. Is it just like you're working? I mean, I guess anatomically the same. You're working with the same thing. So
for sure. So transgender women who have had a surgery to have a vagina constructed, they look very similar and behave very similarly to cis women vaginas. So it's really similar. It's been really a really cool part of my work to be able to work with transgender people.
Wow. Do you find that they people would have to, is it more of like getting the mind body connection to having, something different at all? Does that have taken to place, or is it similar, either way? I don't know.
Honestly, most of my trans female clients have better mind body connection than a lot of my cis clients.
Oh, wow.
And
Actually, I'm not surprised.
I work more with like that mind body connection. Some of it can be with people who've experienced a lot of trauma. So that sometimes that comes up, but honestly, I mostly work with that on that mind body connection with people who have been pregnant and had vaginal deliveries. That's when I've seen the system get really funky, and just kind of uncalibrated. And so we do a lot of work to kind of recalibrate the system.
Yeah. Well, I was just telling Corey that was one of the hardest things for me, as even when I went for my hip, she gave me a few exercises to strengthen. So to try to strengthen my pelvis. And so I don't even know what the muscle is. The muscle that's like goes across. Mm-hmm. What muscle is that? Like the one
that comes here?
Yeah.
Like on the front?
Mm-hmm.
Yeah. Your transverse abdominis.
So she was like giving me exercises, and it was mostly all about like breathing. And I had to it was very hard, and it still is when I do it, to concentrate on moving that muscle, because it was like a counterintuitive to my breathing and how I'm moving that muscle. And so for me, I know it's so hard. Like the mind, maybe it's better for Corey or someone who does do a lot of yoga that already has that mind body connection. But I find that that's one of the hardest parts for me, is trying to stick to physical therapy stuff sometimes.
It does get easier. I will tell you, it does get easier with more practice, but just creating that, exactly what you're talking about, the connection between your brain and that part of your body can definitely be hard and can definitely be frustrating.
And now, is it, so when I did go, she was telling me that there are some physical therapists who do pelvic floor therapy, and they actually do things from the inside. Now, is that something that you do?
Yes, I do. So that's the way that I can most easily assess what these muscles are actually doing. So because they make up the basically the bottom part of your pelvis, and your vaginal opening is right here. So what I can do, and if someone doesn't have a vagina, so if someone has a penis, I can also do it rectally. And sometimes there are people who have vulvas who still would benefit from a rectal assessment. All of that to say, it depends on what they have going on. I do internal work to figure out what these muscles are actually doing. If people are, so in your instance where you had some of your organs kind of descending, I'm looking to see where the organ's currently sitting, what happens when you bear down, what happens when you take a deep breath, what happens when you cough. Can we check it in standing? Because sometimes people have different symptoms in sitting versus standing, all those things. And I can do it very specifically internally, but an internal exam is always optional. It's never required.
Well, I just thought that was something interesting I didn't even know. And I think it's important that people know that is something that can be done, because I would be like, I mean, yeah, it's a little awkward maybe, because you're like, whoa, I mean, it's awkward for anybody, like even go to the guy, it's just weird. But it makes so much more sense that of course you're going to get much more information that way.
And I have a girlfriend who's been actually seeing a pelvic floor therapist, and I asked her if it was you, because I said, "Oh, you seeing the pelvic floor guru in Lakewood?" And it was you. But she was mentioning how her therapist has given her tools to use, as in they're kind of they're sex toys, really, to use to do these exercises, next to breathing and stuff like that. When you're doing these exams, do you do like sonogram? Like, how they have, if you're pregnant, they'll do I don't know any of the medical terms.
That's okay.
But are you, is that something that you recommend to certain people, or are sex toys even a part of your world?
So I talk about sex toys all the time.
Oh, okay.
So there are a couple of different ways to go about that. So sometimes people will already have sex toys, and so we can use, and I'm like, two birds, one stone, right? My goal is not typically, like, certainly in my office, people are not becoming aroused, right? You're not having orgasms in my office. There's nothing sexual. It feels like a doctor's office. But what we can talk about is, okay, what you already have if, for example, you're having pain with penetration and it mostly hurts like first on initial insertion, can you use a vibrator that maybe you already have around the outside here to get those muscles to relax, right?
Mm.
Just like vibration up in your shoulders feels really good and can get those muscles to relax. It's exactly the same. So then there are tools like dilators that are shaped kind of phallically, but they're much less interesting. I'll be honest. I think they'd be really kind of boring sex toys. They don't normally vibrate, and they're shaped kind of like a cone, like a big tampon, sort of. Not to say that you can't use more exciting. You could use sex toys for the purposes of dilation, and you could use dilators for sex toys, but they're not as good as actual sex toys.
And that's what it was. She mentioned she had a couple of different dilators and practicing with those. So cool. I love on your Instagram, it says, one of the posts, stop putting a penis inside a flaccid vagina. Yep. And I'm like, oh my God, I've been doing that.
I know. And so people who have a lot of pain with intercourse are like, they're having intercourse for all sorts of reasons, right? And they might not have any orgasms accessible to them because it's too painful, or they don't know how, or it takes too much time, or they're too uncomfortable asking for what they want, any number of things. And so people are like, okay, they're basically using their vagina as a receptacle for a penis for their partner's pleasure. And that's okay. Like that's a decision you can make. But if you're expecting to have a good time doing that, you're going to be disappointed. And so a lot of people are just not giving themselves enough time because we don't talk enough about like what physiological arousal looks like in people who have vulvas, which is different than it looks like in people who have penises.
Yeah.
So yeah, a lot of that is education. So I do talk about a lot of that stuff because people come in feeling like, oh my gosh, there's something wrong with me. My sexuality is broken. I don't work right. Like I can't have an orgasm from penile penetration. And we have to have a conversation about most people who have vulvas do not orgasm from penile penetration alone. So lots of things like that. Your body needs time to warm up. Just like, a penis needs time to fill with blood so that it's not flaccid. Your vagina also needs that. And this is how that works.
Yeah, I need to be kinder to my vagina and give more time. I know, I'm impatient with it. I'm like, hurry up.
I hear you.
I didn't mean to interrupt you. I know, it's like, and I like that, like seeing that post, that just changed my whole perspective. I'm like, now that we have all this extra time, why don't I slow that down a little bit? And my partner actually he's always happy to take his time, but I'm the one rushing things, it's not him. So this is I just think this is fantastic. And I love to know that there's someone like you out there. And then we haven't even gotten to postpartum, right? All the different reasons why people come in due to postpartum, and if they got a C-section or not a C-section. And that's just all interesting. And
how is that different? How does that affect the pelvic floor specifically, or does it if you have a vaginal birth versus a C-section?
Yeah. So with a C-section, there's no risk that you have a perennial tear. If it's an emergency C-section that started with you trying to push, maybe you could. But by and large, if you have a C-section that starts before the baby enters the birth canal, then you're not going to have a perennial tear because the baby never gets there. So that would be a tear here, right? But people who have C-sections can still have pelvic floor dysfunction. They can still leak. They can still have painful intercourse because the very act of being pregnant can kind of make the whole system discoordinated. Not to mention what may have been happening even pre-pregnancy. A lot of people are like, well, I didn't leak before. And then I'll ask them some questions and they're like, actually, I did leak when I jumped rope or when I lifted really heavy weights, things like that. So, or when I laughed really hard. So all of those things that can contribute. And then if you do have a C-section, that's a whole other thing because it's now an abdominal surgery. It goes through multiple levels. You have a scar you have to work on. And you can still have pelvic floor dysfunction. So it's a little bit, there are some different considerations, but a lot of the education is the same.
What got you into this work?
So
it's a good question. It's a long story. I'm trying to think of the quickest way to tell it.
We love a good story, and so do our listeners.
I appreciate that. So I wanted to teach an undergraduate anatomy and physiology course when I was getting my doctorate degree because student loans, and it was going to give me a stipend, and I had to give a teaching demonstration. And so for my kind of audition, I was doing reproductive anatomy and physiology. and realized that all of a sudden realized that these little 18-year-olds in Atlanta, Georgia may have never heard the word fallopian tubes before, and it was going to come out of my mouth for the first time. And that felt heavy and like it had weight. And so I reached out to a bunch of different people, advisors I had, including one of my advisors from college where I had been part of a sexual health education program. And he gave me a bunch of resources. He put me in touch with a bunch of people. And by put me in touch with, I mean, gave me a bunch of people's names and email addresses who I then cold emailed. A bunch of people who I had no business speaking to as a lowly first-year graduate student. One of these people was Dr. James Trussell, who's actually the person who did the research. When you hear that the birth control pill is 98% effective, he's the person that designed those studies for all different types of contraception. So all of that to say, I didn't know who I was emailing. I said something that he must have thought that he thought was clever, and so he actually responded to my email. So I'm grateful for that. And I ended up at a conference. He offered to comp me into a conference all about contraception and contraceptive technology. And I was the only person under 30. I was the only person who will never, ever prescribe medication of any kind. But one of the presenters there talked about how one of the reasons that people might come into your office, yours being PCPs and family practitioners and OBGYNs for that matter, is that they might be unhappy with their sex lives and they might think that there's something wrong and that there's something wrong with their libido. When in actuality, it might have nothing to do with the physiology and might have things to do with like you're a new mom and when you're horizontal, you just want to be asleep, or you have a lot of anxiety and you can't stop thinking about the things that are making you anxious instead of having sex. Or she mentioned that you have muscles in your pelvis that can be too tight and can be painful. And I was in physical therapy school and I was like, I have never heard of this. Why have I never heard of this? Tell me more. So that was kind of the very beginning. And then a year later, I needed a pelvic surgery myself. I had a urethral diverticulum, which is an outcropping in my urethra, and it was causing me all sorts of issues. And so I had that repaired and needed pelvic floor physical therapy afterward, and was so my physical therapist was amazing, but I was so upset and so discouraged by the way that the care I received from some of the other members of my healthcare team, including the surgeon, that it really left a lasting impact, and it has honestly shaped the way that I practice entirely.
Wow. And when did you start this practice?
I started it in February of 2019, so a little bit more than a year ago.
Oh my gosh, right here in Colorado.
Here in Colorado, so
After
it's in Lakewood.
6 months, you had just moved here, and 6 months later, you said, I'm going to start a business.
Yeah, it was, I was an insane person. I was also planning my wedding. So I had just moved here. I was planning my wedding. I had not been living in my previous residence in Atlanta for 30 days. I had been traveling. It was just, I was a mess.
That's how you do it.
Just all at once. Just get it out of the way. Yeah.
Wow, that's great. What a cool story.
It was a story. It was a story.
And people love you.
Yeah.
I see your reviews. I mean, your Instagram is just like blow it up. It's just so cool. People love it.
It's been really awesome to grow a community and be part of a community. And that's what I had always wanted. And that's certainly what I felt like I was lacking as a patient getting my own care. So I'm really, really grateful for that. And I really love it.
That's what I was going to ask you. Like, what about that experience for you are you changing? Like, what was that? Because I kind of feel the same way. Like I said, I had that surgery 10 years ago, and it was, shortly after, maybe a year or so after I had my second child. And I was a mess. I had postpartum depression. I had 2 small children. I was not thinking clearly. I remember going to the doctor and going to the surgeon, and I tell my husband, I'm like, I remember you guys sitting there talking, and they had, he's drawing stuff on the whiteboard and explaining everything. And I was like, but I literally do not remember anything that was said. I don't know what was happening with my own surgery and my own body, like what was going on. And I'll also never forget afterwards, I did have to go home with the catheter, and I had it for about a week or two, just because I wasn't able to, to go. And I remember going and having that removed, and I was getting some stitches taken out because he also did a labiaplasty, which I fully didn't even understand what was about to happen to me. Like I didn't know exactly how that surgery was going to happen. I thought that it was like more of a evening of things out, not like a complete removal of it. Like it was just like, I was very surprised when I woke up of like what had happened to my body basically. But I remember going in and having these sutures removed, and it was hurting, and the nurse telling me this shouldn't hurt you. Like she just kept like snapping at me, and like the whole experience was just like, no, but I didn't feel connected. I didn't feel hurt. Like, you know, but I wasn't standing up for myself either. Because I just wasn't all there. And like nobody noticed. Nobody was like, okay, like you're not engaged. Like, you know, like we're about to do this big thing onto your body and you're not engaged. Like, you know, and so the whole thing was just really an off-putting experience for me. And it sounds like maybe you had something kind of similar. Like, what about that happened to you? And like, how are you different?
Yeah. So similar in regards to, I just felt like all these decisions, these medical decisions were made for me. I felt like I was a spectator to my own healthcare. And I was learning to be a provider. So this, I think, is the thing that made it so clear to me, is that I spoke the language, I spoke the medical language. And not only was I learning to be a healthcare provider, this was my specialty. Like this was my jam. And I still didn't feel like I could get good care. So I was like, what is happening to the average person who doesn't even know like the difference between a vulva and a vagina, or what the hell pelvic floor is in the first place? And so just that realization made it so clear that things had to change. And so one of the things that is different for me now as a provider is that feeling of like, I absolutely, when I was a patient, I was the difficult patient. I knew I was the difficult patient. I didn't want to be the difficult patient. I had tried. These were people that could have been my colleagues, right? And I did not want to be a difficult patient. I wanted people to have the best opinion of me. But I didn't feel like I could get the care that I needed, or that, again, that my values were being considered even a little bit. So one of the things that I try to do via Instagram, for example, is tell people like, you can be a hard patient. You can be a difficult patient. You are the expert of you. So people come into my office and it's like, great, I feel so honored that you've included me in this process. I consider myself an advisor. I am not the expert in this room, because my expertise, or what I know about the pelvic floor, means diddly squat without your expertise about what you're experiencing in your own body. And that's something that I don't know that I would have gotten to if I hadn't had that experience of feeling like I wasn't even in the conversation as a patient.
Totally. And so for people, do you find that like the whole prolapse thing, is that usually something that only happens to people who have had children, or is that something that happens to people who haven't?
It can happen to people who have not had kids. I definitely see it most frequently in people who do. So here's the thing about prolapse. So this is the other part of my model, which is bladder, uterus, and rectum. So again, with the visuals are just so helpful. They sit snuggled up like right inside that pelvic bowl. And so what can happen during pregnancy, and they sit like kind of squished together like this.
Wait, one more time. We got the bladder, we got the uterus, and what else? Oh,
rectum.
The rectum.
Yep. And so they all sit like this.
Okay.
So this would be pelvis is facing this way.
Yes.
And so what happens is that uterus becomes the size of an actual watermelon, and baby takes all of the nutrient, right? Baby is running the show. So it pushes bowel and bladder out of the way. And then baby comes out and the uterus shrinks back down to something resembling the size it was before, maybe not exactly. And bladder and bowel have to find their way. Sometimes they find their way exactly back. Sometimes they do not. And so there's a certain amount of organ descent, which is totally normal postpartumly. So people can have, their bladder can sit a little bit lower, their rectum can sit a little bit lower in the vaginal canal. And this is why doing the internal exam, it can be helpful, because basically what I'm doing is I can feel these things from the inside of the vaginal canal. So some amount of that descent can be normal and can have no symptoms at all. Sometimes people can have these organs be within a normal range and have a lot of symptoms. Sometimes the bladder can actually, I've seen it in people where it's actually almost outside of the body, and they have no symptoms at all. So where the organs are sitting and what the person is experiencing are not necessarily like a one-to-one correlation.
Huh.
So a lot of my job is figuring out, okay, what if it's not the organ falling out because maybe the organ's sitting in its normal spot, or like a normal spot, then what is it that's causing that? And a lot of the time it's the muscles. It's actually the pelvic floor muscles that are tight or uncomfortable or just sending the brain weird signals. And so then we have to kind of, again, recalibrate that system so that the signals stop being sent and the person stops having symptoms.
And do you find that for the prolapsing, can that be something that is fixed with just PT? Like, can you strengthen that stuff enough to get it back to where it needs to be without having surgery?
Yeah. And so that's a good question. I think, so that's part of why I think it's important to point out that you can have these organs being in an abnormal, quote abnormal place, but have no symptoms at all. Or be in a totally, quote, normal place and have terrible symptoms, right? So I think we have to separate what's happening with the anatomy and what's happening with the symptoms. And what I would say is that sometimes the organs will go back to a more, quote, normal place, and that can have things to do with like breastfeeding, whether you're not you're breastfeeding, what your hormonal levels are, what your hormones are doing, and time. But sometimes they don't go back, and what we're doing instead is we're providing a lot of strength by strengthening these the pelvic floor muscles, which provides support from the bottom, which can improve symptoms, even if it doesn't necessarily change the exact position of the bladder or the rectum inside of the pelvis.
Oh, that's so crazy what you were just saying. It's just so magical and crazy to think about. All of these things are so connected, and just what you said, like hormones even can play a factor in all of this. I didn't even think about that till you said that.
Yeah, so a lot of people with prolapse, they will have the symptoms, especially like newly postpartum, and then they'll get better as time goes on. But sometimes they'll have flare-ups like monthly, that just a day or two that they feel kind of weird or may feel a little bit more heaviness or things like that. And it's very much to do with how the hormones are cycling.
Oh, that's so crazy. Do you, I don't know what I want to say. I'm just like, my brain is like firing like crazy right now, because I just feel like this is so interesting, and it's not something that gets talked about at all, really. I never really hear anybody talk about that. Do you find that what do you do, I guess, to make patients feel comfortable? Because it is kind of an uncomfortable, weird thing that we're not used to talking about. So what do you do to put them at ease when they come into your office?
Yeah, that's a great question. And that's another thing that I think changed from my own experience, because I always felt like my doctor was only coming in when I already wasn't wearing pants, and it was super rushed, and people were trying to tell me things when I still wasn't wearing pants. And I'm like, y'all, I listen way better with my pants on. Can we just give me a second? So one of the things is always telling people that, look, this is a conversation. So this is not a situation where I'm telling you about your body and what you have to do, and this is the way it's going to be. I would like to tell you how I normally do things and why I think that would be useful. And then I would love your input on whether or not that's something that's going to work for you today. And if that's not going to work for you today, that's totally fine. You can decide if maybe it'll work for you in the future, or maybe it won't work for you at all, and we can come up with a different plan. But this is the space to have that conversation. So that's one of the things. I also ask for consent at every step of the process. So especially if I'm doing an internal exam, but even if all of my exams are external, I like to tell people, okay, this is what I would like to do. And we kind of go through it line by line. Is there anything about that doesn't sound like it's going to work for you today? And then in the process of actually doing the exam, reminding people like, hey, you are totally in charge of this. If this is not working for you for any reason at any time, you let me know, and it is over, no questions asked. And then saying, hey, I would like to do this part now. Is that okay with you? And this is what you can expect to feel. Are you ready? And so it actually really quirks people out at the beginning, because they've never been asked by a medical provider that many times if it's okay. So they're like, yo, I'm good. Like, it's fine. You don't have to check every step. I'm like, no, I do though. So I'm going to keep doing that. You can just keep telling me yes, if yes is the answer that feels good to you. And you can tell me no, if no is the answer that feels good to you.
Gosh, can you just teach all the medical professionals? Can you teach a class to everyone about that?
I'm seriously considering doing an online course in trauma informed care for providers. It's like in the very beginning stages of just being thought about, but I'm considering it.
And that's something too that you just made me think about, and like the trauma, because it can be so many different things. It doesn't have to mean that you had some kind of like abuse happen to you or attack happen or something like that. Like your body can store trauma from other things. Surgery, that's a trauma, right? And so it's like, that's important, I think, to talk about as well, for people to be aware of. Like, no, your body may be tensing up because it remembers a trauma from a surgery or maybe some kind of other bad experience, or, whatever that may be. You maybe you had a terrible bowel movement that caused trauma, like, all of those things, right?
Yeah, totally. And I think in my instance, I had medical trauma from my experience in the medical system. And so as a medical provider, I want to do no harm, no harm. And so part of the reason that I treat the way I do, again, comes back to my own experience. And I ask consent every step of the way because I want people to know that they're allowed to tell me no, because that's, again, part of that conversation. And my now not so secret hope is that if you can expect your medical provider to ask you for consent that many times, that maybe we can expect that other people in other situations will also ask us for our consent and wait for the answer.
I think consent love that. Is I think it's polite, but I also think it's real hot. Not necessarily from my doctor, but from a partner. I'm down with that. And
for sure.
This is lovely, right? This just sounds just wonderful, right? I want to work with you. I'm like, oh, could you be my doctor? You mentioned a little earlier about a community that has started, and I want to know a little more about what that looks like. Are there people that are joining together and are talking about this and are supporting one another? What does the community look like?
Yeah, I think right now a lot of it is kind of centered around my Instagram and just people being willing to share things on the internet with me. So I love that. And then I also work in communities of healthcare providers who feel similarly to how I feel. So I'm in a couple of different ones, and I'm really grateful for that too, because I can't do everything, and like not everything is my jam. And so I have to have people that I really trust to send people to. So with that being said, if you have providers that you love and you think have been really wonderful, I would love to get their names, because that's such an important part of providing good care to folks. So yeah, that's primarily what it looks like right now. We'll see kind of how it develops in the future. I hope that it does.
Mm-hmm. And what does your continuing education look like for yourself in your own practice?
I'm very nerdy, so I'm always doing continuing education. You can probably tell I get like real excited. You asked me one question about the pelvic floor. I'm like, wait, hold on. I'm going to go get my mom. So I can't even tell you what the actual required number of hours is, because I am always over it. I just don't even think about it anymore. But I like to take courses from physical therapy providers, but then also in things like how to provide affirming care to people, and how to set up situations so that people can tell me who they are, as opposed to having to break down my assumptions about them to have to build it back up. So a lot of things like that. Right now I'm in an ongoing course about management of female athletes and some of how to get people back to really high level activity without leaking or pain. So yeah, I'm always reading because I like that. I just am like that.
And when you're not reading about the pelvic floor and studying up on things, what do you like to do for fun? What does your life look like outside the medical world?
Right now, my life looks real weird. I love to dance. I take classes, just sporadically, never anything consistent, because I like doing it on my own terms, on my own time.
So any type of dance. There's no like salsa. You're not all about salsa. You're not all about tap. You're just all over the place.
Tap is probably the only one I really haven't done, actually. But like,
I don't know why I thought of tap.
I love it. Ballet, jazz, modern, hip hop, salsa, merengue. Yeah, I don't waltz very much. I think the music is kind of boring, but that's pretty much how it goes.
Cool. So you dance a lot. What else are you doing?
I read a lot of fiction as well. This has been a great time because I've been doing some book clubs. So
have you
been
not
good.
been able to see clients?
I am now. I definitely, things were kind of on pause as I figured things out. Technically, physical therapy offices were open, but I did close mine because I wanted to know. I just didn't feel like I had enough information to keep people safe, and so I wanted to find out. I wanted to make sure that I felt good about my decisions, and I didn't want to look back and think like, oh man, I wish I had done it differently. So I am seeing clients now. I do also see people via telehealth, but it wasn't as busy as my normal in person.
Gotcha. Well, That's great. I'm so glad to hear that things are back up and running again for you. And you're a one-woman show. You're running this business. This is all you.
Yeah. I have no idea what I'm doing. Figuring it out slowly, one step at a time. Every day is different. Every day is humbling. Nothing has been as humbling as owning a business has been for me.
Right. Well, and now you're running a business during a freaking pandemic. So
yeah,
it's like the whole world. We're all just literally having to take everything a day at a time right now and figuring it all out. And what changes are you having to make? You doing masks and taking temperatures and things like that?
Yeah, I see. My practice is so small kind of by design because I want to be able to give people really individualized care, and that takes a lot of time. I have not been taking temperatures. I've mostly just been screening people, like, have you or anyone in your household had symptoms in the last 2 weeks? Cleaning everything incessantly. And I always wear gloves, so that's not different. And then the masks, which I hate so much. One, your own recycled breath is just not a good time. And I hate that people can't see my face to know, like, hey, I'm listening to you. And then I can't see other people's face, like, because it often gives me some information about what's going on. So that's my least favorite part, I think.
Yeah. Well, hopefully we won't have to do that too long.
Yeah, I don't know. We'll see.
Yeah. I mean, it's going to be a little while, but.
Are you in your office right now, Krystyna? I have to ask.
No, I'm in my second bedroom.
Oh.
So I don't know if you can see my like teddy bears.
Yes. I was like, oh, she's in her office. Oh, look, there's teddy bears that'll comfort you.
No, there are vaginas on my office wall, to be honest. They're like pelvises. They're pretty. They're not medical. I have not gotten more confident or more compliments on anything in my life than the pretty pictures of pelvises I have on my wall.
That brings me to another question I have for you. Because I think a lot of us, because things don't get talked about, and especially like, just growing up, how many people, just people in general, men, women, anybody, how often are you surprised about how little we know about our body and like our body parts? Because like you said, like not knowing the difference between your vagina and your vulva, or like all of these different things. How often does that happen?
Well, I told you my story started in Atlanta, Georgia, and so I'm not surprised anymore. I normally ask people before I give them information on pelvic floor stuff, like how familiar are you with the pelvic floor? I'm honestly more surprised when people are like, oh, I feel like I know a fair amount about it. I feel pretty confident, like, or comfortable with the subject matter. And I'm like, that's amazing. People are like, I know it's a thing. I'm like, great. That's more than approximately 50% of people. So you're doing great.
It does surprise me. I feel like I learned so much in the recent years, even just watching Goop. Have you seen that on Netflix? The whole vagina special on that. I was like, oh my gosh, I just learned so much from. Thanks, Gwyneth.
Yeah, no, that's awesome. If people are looking for good, like readable vagina content, there's a book called The Vagina Bible by Dr. Jen Gunter, and she's awesome. And it's very applicable and it's readable, and it just gives you a lot of good information about like what is normal and like what is not normal.
Yeah.
I love that.
Are you writing it down, Corey?
Oh yeah, I wrote it down. I like that.
Well, thank you so much.
Just one more good book recommendation. If you want like similar sexuality content, like good sexuality content, is called Come As You Are. And that's by Dr. Emily Nagoski. And she is also awesome. And that's also very readable and it's just really good information that that was the time where I thought I knew a lot about sexuality given that I was in the field. And then I read that book and I was like, oh, I didn't know anything. So I would highly recommend, also like very digestible.
Awesome.
Do you work with any sex therapists, like, or have a, I would feel like those two things would kind of go hand in hand. Do you have people that you work with in that?
I definitely do. So I do a lot of referring to sex therapists, because sometimes people come in and they're like, I'm having painful sex. There's something wrong with my vagina or my pelvic floor. And we check and I'm like, actually, your anatomy is awesome. You're doing great. Like, this looks really good. I think that there's something else going on that probably has more to do with your brain than it has to do with your pelvic floor. And these are the people that I recommend for you to go see for that.
Oh, that's awesome. It's really awesome. And where can people find you at?
Yeah. So on Instagram, so Krystyna.Holland, Krystyna .Holland, like the country. And then my Inclusive Care website is Inclusive Care is the name of my company, and it's www.inclusivecarellc.com. And you can email me at Krystyna with the K and funky Y's, Krystyna at inclusivecarellc.com.
Awesome. And we'll put all those links on our website too.
Perfect.
But it's been really awesome. And thank you so much for coming on here and just chatting with us and sharing and,
thanks, Dr. Holland.
Conversation going.
But yeah, thanks for letting me nerd out.
No, thank you so much. We love it. We love it.
I wish there's so many questions.
Yeah. Well, I'm sure you have some videos on your Facebook page and your website, so people can go on there and see some of your videos too.
Yep. I am all over the internet.
Thank you so much for taking your time out today and sharing it with us.
Thanks again.